Okay, so I'm taking this video again. This is March 28th. It's about 10 o'clock in the morning or so. And I realized after watching the video that I made yesterday when I was walking that my breathing was not appropriate for the amount of exertion that I was doing. So I did go ahead and start prednisone. And I'm actually doing this video not necessarily for everybody else, but I have a hard time treating myself. I have a hard time looking at myself and determining if I need help or not, because as a patient you're always kind of like you're always kind of basically like negating what your symptoms are, or in my case a lot of times when I get panicked or scared I exaggerate my symptoms. After having been through a cardiac arrest and near-death experience, well, I guess they weren't near-death experiences, death experiences, you can get a little paranoid about your symptoms. So sometimes you can kind of overblow them, or a lot of times what happens to me is if they're really serious, then a lot of times I negate them, because sometimes I think that if I talk myself out of the symptoms that I can just make it go away by positive thinking. So yeah, so this is basically a test. This is the same route I took yesterday, and I just want to see if my breathing is better today than it was yesterday. So I took my second dose of prednisone this morning. My chest feels better. I'm actually not having as many symptoms, but I'm also fasting. My brother and my entire family are fasting right now, and praying for not just everybody that was caught up in the cruise debacle, but the entire world right now needs our prayers and the concentrated effort that we can give them. So I'm hoping that today, when I look back at this video, that my breathing will be better. And of course I'm aware of it today because after looking at the last video, but it's kind of important for me to kind of stay on top of those things. And again, if you're reading this or watching this, it is not recommended to do prednisone or ibuprofen or any kind of anti-inflammatory. They are telling the general public not to do that. So I really don't want to be the person that comes back behind all of the medical professionals saying, well, I did prednisone and it actually helped. Every single person's body has different things going on with it. Mine sometimes will, it'll actually affect I have like a lupus type syndrome that attacks some of the parts of my body. So anyway, so that's, sometimes I have the pericardial effusion, so prednisone for me is like candy. A lot of people can have really bad symptoms from prednisone, especially psychiatric symptoms, which is kind of funny because my lupus is actually the reason that I have the psychiatric symptoms. So I'm one of those weird people that when I take prednisone, I actually have a better mental status rather than a worse mental status. But I know that my kids have gone on prednisone and they would just sit there and cry and get so upset. And I realized, I looked at them and said, you're on prednisone. It's just the prednisone. And when I explained to them that it was the medication that they were on, they would laugh and be like, well, why didn't you tell me? So prednisone is not to be used without a doctor's prescription and without a doctor following you, because prednisone is also one of those drugs that if you stop prednisone like abruptly without actually going down in dosages slowly, you can really mess yourself up. Like it's not the drug that you want to be experimenting with unless you know what you're doing. And you know, I'm probably going to get in trouble for dosing myself from my doctor, but I keep prednisone with me all the time because of the lupus, so it is something that I use very sparingly. And another good tip for you guys so that you won't use it without a doctor's advice is it does make you gain a lot of weight. So my advice to you guys is talk to your doctor. Right now I'm not really trusting people in charge. Everybody that's been in charge of me since I left for Florida has given me either misinformation, complete lies, has made decisions that were, in my opinion, very dangerous. And in some cases, not just my opinion that they were dangerous, but proved to be extremely dangerous. And we won't know the extent of the damage that was done by those decisions until we look back at all of this. And who knows, you know, we may look back on it, and once we have all the evidence, we may actually determine that the decisions that they made saved a lot of lives and made a really horrible situation much better. But we're not going to know that for a while. But from a person that was having those things done to them, they did not appear to be decisions that would save lives. So Atlanta is actually, there's a lot of people, street people out that I am assuming have not a lot of place to go. So make sure that you guys are protecting those people. They're extremely vulnerable. I took a whole bunch of them over to Waffle House the other day, but made sure I'd stay pretty far away, but at least got them fed. You know, reach out and touch somebody in a different way if you can help out. Now, I was on a hill. I don't know if you guys can see that, but I'm not necessarily out of breath because of my chest pain. I'm not having a lot of chest pain right now. That was a little bit of a hill, those two sections. So I am a little out of breath, I can tell. But there was a hill there, and I have been laying in bed a lot. So symptom-wise right now, a little check. No chest pain. I can take a deep breath, and I'm not having that pleurisy and the pressure around my heart area like I was, and like I normally do with the pericardial fusion. So I am anticipating that the prednisone is actually working on that. So that's good. Sorry, I had like a weird scare there. So anyway, I am still hoping that I'm going to be able to get a car here probably around April 8th and get out of Dodge. I know that I'm falsely taking some of the inflammation down in my body, which may actually delay symptoms, but symptoms are kind of strange, you know. Sometimes they will delay the symptoms long enough that the virus can actually work itself out. So even when I stop the medication, the virus will be gone. But right now, until I get that chest x-ray back, I don't know if there is a beginning of SARS in my tissue, which will kind of show up as an opacity. It's kind of like ground glass When you look on an x-ray for somebody that's getting ready to start that component of the disease, you'll see like a ground glass kind of consistency in the lungs, and it's a telltale sign. It's the first telltale sign that the disease is there. So because they wouldn't tell me that it was okay and they wouldn't tell me it was not okay, I don't know exactly what they saw. So if it is the telltale sign of SARS, COVID-19, whichever one, I guess the people on the boat tested positive for all three. But so we'll have to wait, and that should happen tomorrow night at 9:38 p.m. where I will actually get the results of that back. I won't be able to see the actual image, but I'll be able to read their report, and I would hope that they're not going to be lying on their report to cover their asses. But that's actually been one of my bigger fears than the virus itself. Was I knew that people were lying. I had proof that people were lying, and when people are trying to protect a lie, sometimes they do some really stupid things that are worse than the actual lie. So that's actually been my fear. My fear of being on the boat was basically for that reason, is that I could tell that what they were telling the world was completely a lie, and I had proof to back that up. And so that was one of those things where I was nervous about it. So that's all I have for today, and I actually feel fine, so I'll have to look back at this video but compare it to yesterday's. But I'm feeling pretty good, and we're using elbows, and of course I always hit 4 at the same time as 7 because my elbow is not very, I'm not doing as well with the coordination on my elbow as I am with my hands. So, but trying to protect everybody, it's hard. It's hard. It's hard to protect yourself. It's hard to protect others. It's hard to do what's in your best interest as well as the interest of everybody else. And you have to make some decisions that are tough. You know, staying put, staying in your house. No, it's not no fun. But it's actually what's best for you and the public in general. And right now, if there is a component of SARS, the chances of people just dropping dead from having a very acute, very quick lung involvement is a little bit higher. So you don't want people running around driving cars and doing all kinds of stuff that require a lot of skill, if that's going to happen. And it appears with the world shut down that that's the component that nobody's talking about. So that's definitely one of those concerns, and one of the reasons why I've been so scared to go to sleep or to be in my room all by myself, because there is a component of sudden death that I've gotten wind of from Wuhan, as well as from some stories that were here in the United States. So you guys stay safe. I'm gonna analyze myself and see how this prednisone is working.